You had asked me about Botox, and certainly it's the most commonly injected agent for aesthetic purposes. And we essentially inject it very selectively in the forehead area and the periorbital area, which is the wrinkles for the eyes. That we use it for, and we do it very with very good judgment because we want a good balance with Botox. We want to selectively tailor Botox so that we can get the effect that we want. Not everybody needs the same dose or the same distribution of the Botox medication, and so it's in itself it's good clinical judgment, and it's also artistically administered. In general, I will distribute in women, depending, again, this is tailored, but anywhere from just 15 units in the forehead for younger patients to up to maybe 40 or even 50 units in older patients that require a little bit more. And in men, due to the thickness of the muscles, the more bulky muscles in general on the forehead, we inject a little bit more, maybe sometimes up to 40 to 60 units at a time, up to that dose. And sometimes it's just much less. So yes, that's how we administer Botox. It again has to be balanced, and we usually the FDA does not approve it for any area below the forehead and the periorbital area. So everything that's done below that for the lower portion of the face is what we call off-label. And that doesn't mean it cannot be administered. It just means that the FDA has not studied it enough or does not recommend that just yet. But again, it's tailored. It's an individual kind of a thing. They serve different purposes. The Botox will actually paralyze the muscle and kind of relieve a little bit of the repetitive motion that we have that creates wrinkles, and generally just very superficial wrinkles or intermediate wrinkles will improve with that. When we have a valley on the face, something that requires volume, we inject it with something that will actually kind of fill that tissue and give us that volume. The most common site is probably the nasolabial fold, this area here, that becomes more prominent with age and with time. And so the filler will actually fill in that valley rather than paralyze and take away the wrinkle by paralysis. It'll actually fill that entire valley and give you a little bit more contour and fullness, and thus the name, filler.
How long do these procedures last?
It depends on the filler. There's several on the market commercially available. There's different densities, and so due to the density and the type of filler, some of them will last a couple of years. Sometimes in the cheekbone area, that particular filler will actually last for a long time, and it's injected at a deeper plane, so it lasts longer. And these other fillers may last up to a year, 6 months to a year. It depends also on the metabolism of the person and the amount that you put in there, the amount that's required. Sometimes it's a minimal amount, but if it's a minimal amount that you put in, then sometimes it may be metabolized a little bit faster, and may require a repeat kind of a procedure in 6 months, 7 months, a year. There's always a benefit and a risk that you have to assess as a clinician. Botox in general is very safe to use. Again, it has certain caveats that the clinician's experience will allow to address. You want to paralyze selectively. So if you can paralyze any of the muscles that you want to paralyze, that is also true for muscles you may not want to paralyze. And so you have to distribute it in a way that makes clinical sense, and also makes sense to the patient, to their aspirations. Also, it has to be understood that these not everybody is a candidate for injectables or for these things. Some people just simply require a different treatment, like a mini facelift or a facelift. These are all things that lead up to that kind of a procedure. Sometimes in certain faces, fillers are just seen to be fillers. I mean, they're very noticeable, so you don't want that artificiality of the filler. So not everybody's a candidate. You just have to see who is the best candidate for that kind of thing. A lot of people, sometimes it's Hollywood actors and actresses, sometimes it's just people that we know who they are, unfortunately. But again, it's a balance. People come in with a certain expectation that they want to fulfill, and it is also up to the clinician to understand and also give them realistic expectations, and also recommend what will look natural or will have a positive aesthetic impact on them. Sometimes expectations are not realistic. Sometimes they want that look or a certain look that may not be what they need, and so you have to make the best recommendation for them, so that they get just enough but not too much. I know that really says nothing, but really it is that fine balance. It's very objective and subjective at the same time. And remember, if these fillers essentially last a certain amount of time, then you have to account for that sometimes. So sometimes people are very eager to get the entire product, the entire syringe of products, because of that, because of other factors that may be less important than the actual appearance. And so that's something that has to be addressed right there on the spot. Botox is advertised very frequently by price. I recommend that rather than looking at the price, which is on average more or less the same. It varies very little for that particular product, but engage the person that is going to treat you. Talk to them, see how you feel, look at their certifications, and it is based more on that than on price. Don't go by prices, because you can't really put a price on good practice. So I recommend that put the price aside, look at that as something secondary, but make sure that the person taking care of you is number one, who they say they are, that they are certified, and that they are in a reputable place. And that's my best recommendation to you.